All right, next talk. I guess myself and Dr. Dan Kuebler. It's an honor to work with Dan, and hopefully we're going to present some interesting new information. Our normal method is we harvest bone marrow, we aspirate it out, and then we put it into a system. There's a few up there that pretty popular, used throughout the country and probably throughout the world. So basically, centrifuges, they work by removing lower density plasma and a higher density of cells. So you're getting plasma on top and then a cell layer, and then red cells, being iron in them, are going to be heavy and drop to the bottom. Anyway, aspiration technique is important, and people say, why do you get counts? And everybody relies on a machine to do what the doctor at this point in time needs to do. So how you harvest these cells, or this bone marrow, right, small volumes are better. And now we do a little more harder little pull on it to take that first cc or so, and as you go up, though, you're getting a little less pressure because you've got a syringe now filling up with bone marrow. And you can pretty much tell when you got a good draw or not, or at least I've come to that conclusion, and actually Dr. Kuebler can address that. He knows when I got a good draw because he can look at it and tell when I got a good draw or not. And part of that is the thickness and the quality of the tissue when you're looking at it and actually just rotating it in a vial. So we did this study, and this is what we basically did. Marrow aspiration from iliac press with the marrow solution device. We did it from the PSIS. We used 2,000 units per ml heparin prior to aspiration. No additional heparin or anticoagulant is used. Endpoints included a total nucleated cell count, fibroblast colony or CFU count, which in our literature today, and this could change, but at this point that's the best way of looking at the cells that actually may do some healing. This is our data here, and you can see overall, most people say if you get more than 1,000 CFUs, you're in pretty good shape. With the exception of one, we pretty much did that. And in some cases, some of the biggest numbers I've seen, 6,700, 5,200, 4,200, so pretty impressive numbers.